Hi, I'm Dr. Kevin Mailo, and you're listening to the Physician Empowerment Podcast. At Physician Empowerment, we're focused on transforming the lives of Canadian physicians through education and finance, practice transformation, wellness, and leadership. After you've listened to today's episode, I encourage you to visit us at PhysEmpowerment.ca, that's PHYS, empowerment.ca, to learn more about the many resources we have to help you make that change in your own life, practice, and personal finances. Now on to today's episode. Hi, I'm Dr. Kevin Mailo, one of the co-hosts of the Physician Empowerment Podcast. And today I'm very excited to introduce to you Marlies van Dijk. And Marlies is, Marlies, before I talk about you a little bit, I'm going to say it's a little hard to kind of describe what you do because you do so much. And you've had such an incredible career and you've built so much. But Marlies is the founder of Alberta Health Services Design Lab, which is kind of an in-house consultancy for the Alberta Health Services healthcare system, essentially for Alberta, to help on like leadership and direction. But then as Marlies has grown as a leader in healthcare, she's now stepped out and formed the Pivot Group, which is nationwide. Super exciting. And every time I talk to Marlies, I'm learning something, I'm inspired, and I am so glad, Marlies, to have you here today. So can I get you to just start with a little bit about yourself and your journey and how you got here?
Yeah, for sure. Thanks for having me. So I started out in nursing, and I realized very quickly that I was a cog in a wheel and that I could not influence the change that I wanted to make. And I started working in the nonprofit sector, working grassroots with marginalized communities. And I absolutely loved it, but I quickly felt that I wasn't growing there either. So I went back to the health system and I started leading large-scale change initiatives with national organizations, things like Save for Healthcare Now, et cetera. And then I went to British Columbia for a while. So I changed, quote unquote jobs every 5 or 6 years. I'm not one of those lifers, which I'm very proud of. And I'm
inspired, by the way. Keep going.
Yeah, no pension is going to hold me down for life. There's no way.
Good. I love it.
And I ended up in British Columbia working with surgeons across the entire province in 25 hospitals. And once I was finished that, I came to Alberta and I was given a job because I was creative. And I was like, what? Creative? I kind of know I'm creative, but not like in the traditional sense. Like compared to really creative people, I'm pretty straight. But in the healthcare environment, I think I do stand out a bit that way. So I came to Alberta Health Services and I thought, well, what am I going to do here? And then I realized there was a gap in the market inside the organization. There was a lot of improving best practice or implementing best practice, closing the gaps. But innovation there per se was no methodology for innovating. They talked about it. Thousands of people have the word innovation in their title, but actually doing it and how do you do it? So I stumbled upon human-centered design thinking, and I studied labs across the world. And I said, yeah, this is what we need to do. We need to create a design lab. So yeah, go ahead, Kevin.
Tell us what human-centered design is, because the first place I kind of go is patient-centered, but we realize that we're ignoring another part to that equation, which is healthcare providers and frontline staff. So tell us what human-centered design means within our healthcare systems, and talk to us at like everything from the clinic level in private practice all the way up to large, subnational healthcare organizations.
Yeah, I can give you some examples that makes it more tangible. Human-centered design is essentially a methodology that's pretty high level that looks at collaboratively making decisions about a product or service that would meet the need of the user. And usually it's out of the box. It is something that hasn't been thought about. We use a lot of analogies from other industries to gain inspiration. But the method is really that walks you through testing, building prototypes, and creating something that which you can fail fast with. So that's human-centered design. Examples, for example, I just came from Vancouver and we led a 2-day skunk works project and we called it Hacking Wounds, the year before Hacking Pain, where we essentially take 75 to 100 people, clinicians, diverse teams who tackle a problem from a different angle and try to come up with unique solutions and test them right then and there. Failing in healthcare is difficult to do because of the stakes, but we also put way too much time into our work, 6 months, 18 months before we actually tested with our users or patients. And so failing is not an option because we've put this much money and time into things. Like it's cost us
the
X.
Cycle is so long.
It's
right?
so long. Yeah.
When I think about, starting my companies, it's like, oh, try something. And if it doesn't work, try something else. But that happens very quickly and at low cost, right? Because as you said, the stakes are high in healthcare as we deal with, patient care.
Yeah. And I think human-centered design is a method that is what's well known to be the innovation method, but we haven't created a lot of space for people to work in that way, in part because we're all about evidence-based practice, return on investment, show me the impact you can have.
Productivity, output, volume, measurable, quantifiable.
Yeah.
Values.
Exactly. And I mean, if you look at the 3-box solution, which I'm a big fan of, which tells you that future customer bases, future models or delivering service, you have weak signals telling you something might be doable, but you're not 100% sure. Like, virtual care before COVID, we were like trying to ignore it at all costs, right? The US had embraced it long before us, but now we're actually finding that, oh, wow, we can actually provide good care virtually in many circumstances. But why did we not look at that sooner? We know it's more cost effective. People don't have to travel, but it's in essence, we haven't cultivated the space for us to innovate because it's a different skill set than implementing, evidence-based practice where what needs to be done. You have a list, right? It's proven. And future work and delivery models are not proven yet.
And talk to us about the 3-box approach, just in brief. I mean, I just love putting new ideas out there and get people to look at the world differently, not in any great depth. Give us an overview.
So 3-box solution, which I'm in love with, is incredibly simple. So if you Google it, you'll find some great videos. The author talks about, we have box 1, that's day-to-day operations. It's what you know how to operate a hospital. You know how to deliver services at scale. You know your business. We're very good at that. Box 2 is what is it that you can let go of to create the space to actually look at new service models and new potential future customers. So that's the letting go phase. You know how we have trouble letting go of things? Everyone does. So you actually have to take some time to figure out what you can scrap so you can create space. And that 3rd box is really about, and he says it should be between 10 to 20% of any organization should have dedicated resources and people that look at weak signals. There is no recipe. There is no proven methods for how we're going to move forward because most of our problems are very complex, right? We're not dealing with just taking out an appendix for most of our health issues. We're talking about chronic disease management, delivering care to rural communities. Those are complex problems that it all depends on the local resources to know how you're going to navigate that. So that's a quick summary of the 3-box solution.
Oh, I love that. And let's shift gears a little bit. One of the things, so at Physician Empowerment, we host a lot of educational events. We've got monthly small groups with, a small group of physicians where, we tackle aspects of practice or healthcare or finance. We also have, our national conferences and other events like that. And, whether it's in the formal discussions or a hallway conversation, somebody next to the coffee urn is talking about the culture of large organizations. And specifically what I'm getting at is the struggle to overcome organizational
Yeah.
inertia, right? Like
Yeah.
an object at rest wants to stay at rest. And so, and it's a source of burnout. It is,
Yeah.
because I've heard from so
Totally.
many physicians, especially kind of mid-career, 10 to 20 years in, where they came into the profession, they came into healthcare, and this applies across the board. It's not specific to physicians. They've come in with a certain energy, a certain zeal, a desire to go beyond patient care, to build better systems, to improve delivery, and, being people-centered is part of it. And they come up against organizational inertia. And I've heard this from doctors coast to coast. I hear it from American physicians as well. And so, what does a physician in that position do when she or he is in a leadership role and they're trying to say, okay, how do we break past this organizational resistance to change, to even thinking about new ideas? It's not, it's not even a case of like getting to change and taking steps and trying something new. It's like even having the discussion of, could we do things differently, is like, we're going to shut that down.
Yeah. Well, I've lived it my whole life until very recently. I've survived in health authorities across Canada until now. And I decided to leave on my own fruition, believe it or not. But a couple of things, and of course, I'm super passionate about this, but the first thing to know is you need to find some others who are like you, which sounds easy, but it's not, right? You need to find some fellow, and I call them rebels. I know for some people that might be too much, but you need some people who are innately dissatisfied with the status quo, but they are hopeful. Because if you're dissatisfied with the status quo and you are miserable and don't see any hope, then it's, that's not fun to work with. So you need people who have not given up the spirit. I also have learned over time that you have to avoid the formal structure of a health organization. You have to do it on the edge. This is not something that's going to be in an operational plan. This is not going to be approved by the CEO with the multi-year implementation plan. Real change happens on the edge, where you start small with a group of people and see if it has some legs before you start talking about it. And that is hard to get your head around in the way that you feel like you're manipulating the system, which is exactly what you're trying to do. You also need to really embrace the fact that you're not going to be super popular. I knew from day one that people thought I was a loose cannon, wildcat, tornado,
all compliments, by the way, as far as I'm concerned. All compliments. I love it. Just keep rolling them off.
I remember talking to a leader and I said, hey, I want to do this. And she said, walk to the elevator. She goes, Marlies, two suggestions for you. Watch your back, first of all. And second, you need to learn how to walk before you fly. She opens the elevator, steps in and goes up. And, I stood there and I said, no way in hell am I not going to fly. So you have to really believe in yourself in the sense that you're not going to back down to keep the job, to keep the pay. Although I have to say, I have really focused, and I've told you this earlier, people said, how come you haven't gotten fired? Like, how is this possible?
Also, love that. Love it.
And it's an interesting question. I think the real reason I've survived is I'm quite a doer. I'm action oriented. So I deliver. So I've always made sure that I'm focusing on something that people know, oh, Marlies does that. Oh, she delivered that. Yet on the side, I do my innovative stuff and my change stuff. So I make sure that I'm not just all about innovation and trying new things. I actually have a day job. And on the side is where you try these new things.
Right.
And then the very last thing that is really worth mentioning is accepting this fact that people might not like you. They might think you're likable. Like, I think people think I'm friendly and they can laugh with me.
Yeah.
But they know it's, they're not quite sure what to make.
It's coming.
Right. They're like, oh God, what's she going to say?
Yeah, I love
it. Managing the discomfort and being really comfortable with getting the answer no. Like, I didn't care. Like, I would get 10 no's. I didn't care. I'm like, yeah, okay, I knew that was coming. All right, go around this person, go talk to so-and-so. I'm going to manipulate so-and-so, and I'm going to talk to so-and-so. And I was continually navigating.
It's a hustle.
It's a
It's a
hustle.
hustle.
Right.
I love it. It's a hustle.
Right. It's a huge hustle. And some people aren't hustlers. I am a natural hustler. Like I am an extrovert.
I am totally a hustler. Love it. Yeah. You and I are very much on the same wavelength.
Yeah.
Yeah.
And so, I mean, I think I also knew that I would get down. Like there was times where I was completely deflated, demoralized, burnt out, but I took those times to recharge and to forgive myself for not succeeding and to lay low for a little while. And then I knew my energy would always come back. And it did again and again. So I just was sort of watching my cadences. And I also knew with my supervisors, because I did have them, believe it or not, that I would need to make them happy too and make them look good. And I focus on that quite a bit, but then, I would time my jabs or time my challenges so that I wasn't burning out my supervisors with me as a nut bar employee, but actually, she's delivering. Oh, and it's worth listening to her at times when the message isn't what they wanted to hear.
I love that. And I think it's also important as we're trying to invoke change is to focus on core values, right? Like this is about making things better for patients and frontline staff. I feel like that's always a centering. That's always a great centering point. It's like, listen, I know we're disagreeing here and I know you didn't want to hear it, but I'm just trying to tell you that this, from my perspective, is a step forward in patient care or a step forward in caring for our burnt out frontline staff.
Right. And just even to build on that, I'm doing a yes and is people quickly realized I wasn't a climber. They knew once powerful. They realized that I was not there to try to climb the bureaucracy, which is what most people anybody. Right. So which most people are into. Let's just be honest.
I'm not. But yes, I get that. Yeah, you and I. Exactly.
Yeah, exactly. Yeah. So once people realized I wasn't in that game, that's a whole other game. Like, it's a Game of Thrones. Like, that. Like it's cutthroat, killer. I wasn't part of that. So for example, if I did a project and I wasn't acknowledged or I wasn't thanked, I didn't care. And I honestly didn't care.
You know what, though? Clearly you're making waves because here you are on the podcast, right? Right. But I mean that, right? Mm-hmm. Because actions speak louder than the words of an email or some little placard or whatever have you.
Well, and I think too, I started to realize you could influence without being high up in the hierarchy, even more influential potentially. Mm-hmm. And they talk about the 3% influences 80% of the organization. You can be an influencer without that position. And so when I first came to Alberta Health Services, I started tweeting. And I was like, why is no one talking outside of the formal email process? And that was fairly new in 2015. And comms just talking about we can do better. And healthcare suffers from X, Y, Z. I have been told by the communications team that I walk the line just right, like just a fine line. I say enough about generally speaking in healthcare. I don't point fingers, but I learned how to be critical yet hopeful and not pointing fingers. So just that wasn't a role navigated. And so my voice mostly came to through social media. I didn't wait for a committee meeting or something,
Oh, exactly. Right. And I think the other thing is focusing on actions, not individuals when we're directing criticism, right? Or focusing on the process, not on the individuals that set it up or run it. Because that gets very emotional when we personalize like that. And there really isn't any role for that. Do you know what I mean?
Absolutely.
I don't think anybody moves anywhere when we start getting into finger pointing.
Exactly. And I also think to build on that is I was invited to many committees, and I actually have a rule that I don't join committees on a regular basis. Like I'm not a member.
Right. You'll come in, you'll speak.
A committee
Drop
land
the
for
mic.
me is like, no, I can't.
Yeah.
But I
No.
got invited to an innovation committee, and I was like, oh, geez, I'm innovation. I guess that makes a lot of sense. And there's some VPs there. Oh my God, VPs! This is whoa. Yeah. I went to the first meeting, and I realized this is nothing about innovation. This is just another bureaucratic process of committee meetings. And I knew that the end game, there was nothing there. I could sense it. And so I actually resigned from the committee after the first meeting. I wrote a nice note, apologized, but I'm...
powerful. You're your most important resource.
Yes, my time is
Where are you
really
spend
important.
Your time? Yeah. I love it. I mean, it's wisdom for all of us in healthcare. We're the rate limiting step.
It's
so
it's
if
easy
I'm busy
to get
translating the Bible into Klingon, I'm probably not doing something else more important.
Yeah, it's easy to get sucked into the way things, the way they design change. And somebody in the hallway saw me shortly after that, and they said, "How did you get out of that committee? I want to do that too, but I can't." And I said, "Well,
you should run a course on that.
Why can't you? Let's get real here. It's all a figment of our imagination. What's happening there? It's just fluff." And I just made really careful calls on that without, offending anyone, I hope.
No, just say, I think I'm more effective not being on the committee, right? Like politely declining. I love that.
Yeah. And call me when you need me. I'm here.
So talk to us about practical ways of communicating. And let me just send my big gripe. I hate email. I think it's a giant step backwards in human communication. I feel like, spoken language, written language, the printing press, really great developments in human evolution. Email was like a step back because how do you address a complex issue going back and forth over an email string with 5 other people on it, right? So for those of you that email me personally, you'll find that I have on my signature line a little thing that says, "I never check this. I'm real hard to get a hold of." And so I'm old fashioned. I want to pick up the phone or go meet with somebody because if it's something complex, it's probably best addressed that way. But that's just one example. And that's my own personal perspective on it. I mean, in the end, yes, emails have to go back and forth. And in the end, there has to be some kind of formal written summary of what was said, what was decided, meetings or whatnot. But in the end, I think, we're just so much more effective when we communicate verbally or face-to-face.
Right.
But talk to us about some very practical approaches. I mean, we covered some of them, but I want to hear more because these are the things that, that courageous healthcare leader listening to this podcast who wants to do more, wants to get out there, wants to begin hustling to improve their healthcare system. But what does she or he need to really hear on the how? What do they need for tools?
Well, I always, made it my mission to have a relationship with the highest person in the organization. And you can imagine that wasn't going to happen through email. So I would use Twitter or LinkedIn. So DM people directly. And ultimately texting is, of course, my love. But my teammates at the Pivot, we communicate through Discord. You're probably wondering why. We just picked Discord because some people are on it, and actually I love it. It's instant. But of course, I'm not in a health organization. But when we were in a health organization, we used, of course, Slack and methods to communicate quicker about logistics. You don't want to email logistics. That's just painful, right? But I did have one of my teammates say, "You know what? I got a text from you. I got a tweet. I got a..."
There we go. Now
and I was like, I am a little bit intense at times. Answer me. No. So I think just also what I've learned is just having fun with your teammates. We at the design lab, we were like family. It was crazy. We fought like cats and dogs and still loved each other. So being able to create a relationship in your team where you actually really like each other and appreciate each other for who you are allows you to work much faster because you can say, "Oh my God, I'm sorry, but this PowerPoint needs some help." People don't want to give negative feedback very easily. We talked about radical candor on my team, and we would have to detox people when they joined the lab because they were
I love that.
the
I found
bureaucratic
that was a learning process for me
detox.
too.
Right. and the first time you need to be able to challenge the boss. If you're not challenging the boss on your team, you do not have a psychologically safe team, and your products are probably crap because no one wants to say, I don't like that.
Throw this one in the trash. Let's start over.
Yeah. And so I think I've been told I've never worked for someone who gives this kind of feedback, like ever. And I'm like, wow, like, do we just go along and say, good job, employees, you're awesome. And yet the work is shit and you know it. So intervening early to create that iterative feedback about what about this and what about this and how can we make this better? I think it's a culture of where everyone can improve the products you produce, because I've seen in formal systems, people can work for 8 months on something and it's not good, but it's too late to comment because you've spent that much time.
Yeah. It's like, a rocket that's never going to launch. Or never going to launch properly.
Right. Right. And I think the Gantt chart and the project management planning for complex problems is an absolute joke. It's like, it's a human system. You think you're going to map out for 6 months what you're going to do? Like, what planet are you from? Like, that's never going to happen. So I have a joke on my team, like if a leader is really into Gantt charts and project management, go to Google. There's tons of templates. I want you to spend half hour on a Gantt chart, make it look good with colors they love. Red, blue, and yellow for some reason. Do a dashboard, put it in front of their faces, and they'll calm right down. Like they see order, they see a plan.
Yeah.
Because that's what we're trained. We're trained to think, and good business etiquette is a plan. And so, I'm sounding horribly manipulative, but that's how we kind of work. We feed the top, a really canned project management plan. And then underneath, you work more in an agile way where you're not living to that Gantt chart because you're going to get information within 2 weeks that's going to throw your whole plan into the garbage. So we play the game. You have to play the game on the outside and have another game on the side. Love
it. Now, here's one that I'm going to put you, and I think we can just keep going because I absolutely love this. Absolutely love it because I'm passionate about seeing healthcare done better. Do you know what I mean?
No, I get it.
Let me be blunt. Let me follow your path. When we talk about closing down beds because we don't have adequate staff, that's kind of like the airliner that you're about to board, that you're boarding. It's about to go for a transatlantic flight, and they're like, oh, by the way, 3 out of 4 engines are working and we're down a few crew members, but we're pretty confident we're going to get through our transatlantic flight. So I'm passionate about seeing things done better. And yet the issue is that I feel like healthcare is always in crisis. There's no margin within the system. And I hear this coast to coast from Canadian physicians who are like, I want to do change, but as a leader, I'm putting out fires all the time, right? As an organization, we're putting out fires all the time.
We're designed to not be in the news. That's how we operate. How can we not have a headline that makes us look bad?
Yeah. So how do you get past that crisis in front of us a month ahead from now and really make space mentally, emotionally, and in our calendars for real change? Do you have any ideas?
Yeah, it's a really tough one. If you are a full-time clinician, it's going to be hard to carve out space because the mountain of work and the mountain of people is just growing of who needs to see you. So maybe going back to that 3-box solution, finding out what you can let go of and actually creating time and space to bring people together to look at different ways of skinning this cat. We're holding on to old models, right? Old models of delivering service. It's clear we cannot ensure that every Canadian has a family physician. I know that might be like a gas for some people listening, but with chronic disease rise, the age,
I'm
cost
shocked.
of the
Even
system.
what I've seen in the 10 years that have been in practice or so, I was like, wow, it really, really changes. Sorry, I'm just going to interrupt because you get a young person like in the emergency department where I work, a young person, 25 years old, has a fall I mean, they may dust themselves off and you may examine them. They may not require an x-ray, right? Like, and yet if that same person was an 85-year-old on a blood thinner that has a fall, like they're getting, a lot done in the emerge.
Yeah.
And they're spending a lot of time there, and then they're getting admitted, right?
Yeah.
And so you are absolutely right when you talk about, like, how are we going to service an aging population with a growing list of chronic diseases?
Yeah, it's gonna, like, I'm from Europe myself. I grew up there and I go there a lot. And, when we're spending 85% in the last year of life, we need to start asking ourselves, is that what we should be doing? And what about, like, what could we not potentially do? And how do we navigate that? Why are people dying in the ICU? I've heard numbers up to 85%. Non-reversible deaths are happening in the ICU of acute care facility. And it's like, that's $4,000 to $5,000 a day when it was not reversible. We know these things, right? So, I mean, this is a huge conversation.
These are big conversations.
Right.
But it starts by having the conversation,
right.
Real change.
And to challenge people. But I think in the end, making sure that you don't burn out is number one. Tackling something that you can make your project that you can some satisfaction from. Because you say to me, oh, you've done so many great things. And I feel like I've barely done anything. Like, I'm hard on myself. And most innovators and entrepreneurs and change agents they're like,
totally.
This is pathetic. What have I done? Yeah. And that is the part about being a change agent. Like, I remember seeing one of my VPs in the cafeteria one day, and I was talking to him, and I was like, on fire. I was in a great mood. And all of a sudden he goes, wow, are you not happy in your job? And I said, what are you talking about? And then I realized, oh no, this is, I'm wired this way. I'm dissatisfied with the status quo, but I'm willing to tackle it. But he wasn't used to it. Like, he thought, he was surprised that I sounded the way I did. So that is definitely a criteria for being a change agent, that you're not happy.
I love it. I absolutely love it. Marlies, I want to just keep going, but I know we have to wrap this up, which just means we'll have to get you on again to talk about these issues, because there is such a hunger out there with physicians physicians and other healthcare providers who are passionate about what they do and the system they work in, and they want change. They want tools, and you often feel alone in this, but you realize you're not. And the wisdom that I'm going to take away is, find those allies, find those people that are like-minded as yourself, and begin to connect with them and see what you can do to start the conversation.
Yeah, find your wolf pack.
Yeah, mm-hmm. I love that. Love it. So again, Marlies, I really want to thank you. And for those of you that are interested, again, it's the Pivot Group that Marlies founded, which is her national consultancy. And it's really incredible.
Thanks for having me, Kevin.
Thank you so much. Thank you so much for listening to the Physician Empowerment Podcast. If you're ready to take those next steps in transforming your practice, finances, or personal well-being, then come and join us at PhysEmpowerment.ca, PhysEmpowerment.ca, to learn more about how we can help. If today's episode resonated with you, I'd really appreciate it if you would share our podcast with a colleague or friend, and head over to Apple Podcasts to give us a 5-star rating and review. If you've got feedback, questions, or suggestions for future episode topics, we'd love to hear from you. If you want to join us and be interviewed and share some of your story, we'd absolutely love that as well. Please send me an email at kmilo@PhysEmpowerment.ca. Thank you again for listening. Bye.